Hello and welcome. Thank you to all of you who have joined us. My name is Ugwa Du, and I am a medical anthropologist and an assistant professor in the Department of African American Studies at UCLA. And I'm joined by my colleague and co-moderator for the day, Adeola Oni-Orisan, who is a family physician and medical anthropologist at UCSF. Together, we founded the Black Feminist Health Science Studies Collaboratory in late 2020 and had our first event bringing together scholars, artists, creatives, and organizers from across the country to meet virtually around the theme, Racial Geographies of Health. Today, we are thrilled that you have joined us for the launch of our new book lecture series, which we have entitled Writing Health Through Black Feminist Theory. Our goal with this series is to create more spaces to highlight the work of scholars who employ Black feminist theory to critically interrogate issues related to health, medicine, and society. Before we get into the meat of our event, a few announcements. You can still silence your cell phones or other devices that might make noise. We would like to thank our event sponsors, the Berkeley Center for Social Medicine, the UCSF Humanities and Social Sciences Department, the School of Public Health, UC Berkeley School of Public Health, the Diversity and Health Disparities Cluster of the Othering and Belonging Institute, UC Berkeley and UCSF's Joint Medical Program, and the Center for Ethnographic Research. We'd also like to thank Deborah Lustig and Maxwell Walker, and I apologize if I mispronounced your name, for all the assistance in coordinating the event today, and especially transitioning from a hybrid event to online. I want to take a moment to acknowledge that UC Berkeley sits on the territory of Huchun, the ancestral and unceded land of the Chochenyo Ohlone. This land was and continues to be of great importance to the Ohlone people. We recognize that every member of the Berkeley community has benefited and continues to benefit from the use and occupation of this land since the institution's founding in 1868. Consistent with the university values of community and diversity, we have a responsibility to acknowledge and make visible the university's relationship to Native peoples. By offering this land acknowledgement, we affirm Indigenous sovereignty and our commitment to hold the university more accountable to the needs of American Indian and Indigenous peoples. The format for today's talk is guided by a Black feminist thought, recognizing that all knowledge is created through practice, collaboration, and interaction. My co-moderator, Dr. Oni-Orisan, and I will engage our guests in discussion for about 40 minutes. Then we will open it up to questions from the audience. Please use the Q&A feature in Zoom.
Thanks, Dr. Adu. And so it is my immense pleasure that I get to introduce you to our two panelists. I'll start with Nessette Falu. Dr. Falu is an assistant professor of anthropology at the University of Central Florida. Before receiving her PhD in sociocultural anthropology with a certificate in women, gender, and sexuality studies from Rice University, Dr. Falu enjoyed a 17-year clinical career as a physician assistant, practicing in neurosurgery, internal medicine, HIV care, and hematology oncology. In addition, she earned her Master's of Divinity from New York Theological Seminary. This interdisciplinary grounding is evident in Dr. Falu's ambitious research endeavors situated at the intersection of medical anthropology, anthropology of ethics, queer anthropology, and humanities, and tackling questions concerning gynecology, affect, sexuality and gender, lesbian praxis, racial capitalism, African diasporic religiosities, and human bioenergy at sites in both the United States and Brazil. Prior to joining the UCF faculty in 2017, she completed a 2016 to 2017 postdoctoral fellowship in the Institute for Research of the African Diaspora in the Americas and Caribbean at the Graduate Center, City University of New York. She was also a visiting scholar at Lehigh University in the Women and Gender and Sexuality Studies program. And finally, she was the 2013-2014 Sarah Petit Dissertation Fellow in LGBT Studies at Yale University. She has published articles in Medical Anthropology, Feminist Anthropology, and the Journal for Latin American and Caribbean Anthropology, among others. She will be talking today about her book manuscript, Unseen Flesh, Lesbian Worth-Making and Gynecological Trauma in Bahia, which is forthcoming from Duke University Press. The book examines Black lesbians' negative affective experiences caused by entrenched intersectional prejudice within gynecology in Brazil. Through rich storytelling, Dr. Falu illuminates processes of worth-making that Black lesbians engage in as a form of resistance to gynotrauma, which she uses to describe the diverse forms of harm that begin in the gynecological room and extend outward into the lives of Black women and gender non-conforming individuals in Brazil. Dr. Falu is also in the process of completing a short film based on this project, which is currently in post-production. Please join me in welcoming Dr. Falu. Next, I would like to introduce James Doucet-Battle. Dr. Doucet-Battle is an assistant professor of sociology at the University of California in Santa Cruz. He received his master's in socio-cultural anthropology right here at UC Berkeley and continued on to complete his PhD in the UC Berkeley, UC San Francisco Joint Medical Anthropology Program. Dr. Doucet-Battle's ethnographic work analyzes the everyday practices through which both health disparities and their remedial projects are created. His research engages questions around race and medicine, genomics, power, subject making, and citizenship, political economy, risk and uncertainty, and African diasporas. He has published in Transforming Anthropology, also in Feminist Anthropology and Catalyst, Feminism, Theory, and Technoscience, among many others. Dr. Doucet-Battle was selected for the prestigious UC President's Postdoctoral Fellowship and completed a visiting professorship in the Department of Black Studies at UC Santa Barbara before joining the Sociology Department at UC Santa Cruz, where he holds affiliations with the Department of Anthropology and Global and Community Health. He will be discussing his book, Sweetness in the Blood, Race, Risk, and Type 2 Diabetes, which was published by the University of Minnesota Press last year. The book threads together the historical demand for African-American bodies in US scientific research within a chronology of 3 contemporary recurrent strategies targeting this imagined population. His work transverses from the plantation to the clinic to the church and back, weaving together a story of how the legacies of slavery are still seen in research related to diabetes. Let us also welcome Professor Doucet-Battle today.
So I wanted to begin with a question, and this is an opportunity for you to kind of tell us a little bit about the key arguments in your text also, but if you could tell us about the path that brought you to this research. What are the questions, the problems, and or silences that motivated your work?
Well, for me, this was a long, winding, and somewhat tortuous path. My project initially sought to investigate type 2 diabetes within the African-American community writ large. I wanted to get a better sense of how the community interacted with the biomedical message around type 2 diabetes, interacted with the technologies of surveillance and monitoring and control, and the ways in which type 2 diabetes is imagined and lived within the community. But over time, I found my project moving away from diagnosis to risk, and the ways in which risk mobilizes new conversations, enlists new categories of people, patients, and markets, and produces new markets. And in that movement from diagnosis to risk, I found my work moving inextricably toward genomics and ancestry through the lens of race and the ways in which race became reinterpreted, reimagined through genomic science. So I began the project initially looking at type 2 diabetes in a somewhat biographical way through my grandmother, who was a type 2 diabetic for most of her life, and how that notion of risk, particularly type 2 diabetes as arguably a maternally inherited risk, informed not only my subjectivity, but the lives of people in my family and in my community.
For that sharing. I just want to take less than a minute to thank Dr. Ugo Edu and Dr. Adeola Oni-Orisan for this invitation on behalf of Black Feminist Health Science Studies Collaboratory, and Deborah Friedman and Maxwell Vanderwalker for all the work, right, in organizing this, and to Berkeley Center for Social Medicine and all the sponsors. So thank you so much for making this space, for allowing these very, very urgent conversations with Dr. James Battle. So thank you, such a pleasure. Okay, I will also try to be brief. But I will actually start from a different kind of angle than shared by my colleague here. So silences was the provocation for getting me to this path. I, as a graduate student in Houston at Rice, I was working part-time as a physician assistant in HIV clinic. And it was actually the first time that I worked outpatient. And it was in those clinical spaces that I started to pay attention to the kind of social world that that people bring into that very interaction medical space, literally inside of the examination room, where I was treating many Black and brown folks of both men, women, of their various sexualities. And so that said, I doing a lot of deconstructing and unpacking of social issues in that space, it kind of became a think tank for me. And at the same time, the Zuna Institute published in 2010 a Black lesbian national survey that they actually titled Black Lesbians Matter in 2010. And the combination of those things that actually changed my project to the focus of gynecology. So I became really interested in the invisibility as from what the term invisibility from my own lens of Black lesbians' experiences in clinical spaces. So it was a result of being in that medical space in HIV clinic, and also these kind of discourses that were coming out, giving attention to Black lesbians in multiple parts of their well-being, and not just health. And so really it opened up a Pandora box when I began to do early field work in Brazil, compared to early field work that I did on the topic of Black lesbians experiences within gynecological spaces in the US as well. And so the comparative for the preliminary work was really, there was a level of intensity around, filled with anguish and rage through Brazilian Black lesbians about in their articulating of the experiences personally, but also like at large. And this is that was my pathway into this research, where I decided to just focus on Brazil, which is, the book argues, the kind of, and that was an evolution, right, which I can share later as well, this argument of how they incrementally enforce their well-being into, within this kind of intimate violence in gynecology. These experiences that are intimate, that we don't regard them as violence, but in how those experiences steer them, right, to kind of evaluate, protect, and chart their well-being within those spaces. And so, yeah, and that I will leave it at that. So we can get some more.
Thank you. I think when you were talking, James, I was thinking of how much when I was reading your book, I felt that you show up in different ways in your writing and in your work, and and actually both of you have used your personal experiences as an entree into this work. And so I'd like to hear about that, but I'd also like to hear about your approaches methodologically. James, you have a sort of impressive multi-sided approach to fieldwork. You were at UCSF Diabetes Teaching Center. You go to the Alameda Department of Public Health, to the biotech in Alameda, a biotech firm in Alameda, to multiple Black churches. And then, you know, there are multiple sites across the country: Chapel Hill, Houston, Baltimore, upstate New York. So I'd like to hear about how this sort of multi-sided ethnography was helpful as you were also engaging these sort of multiple methodological tactics, including which you called collaborative event ethnography and vertical research. So what about diabetes as an illness, as a sort of socially created disease process lends itself to this multifaceted approach? And then for Nessette, I was interested methodologically in your term shadowboxing frame fieldwork. And so if you could talk a little bit about that approach as you were sort of weaving in and out of gynecological auspices, activist organizing meetings, protests, funerals, in addition to what the sort of deep hanging out that you were doing with the Black lesbians that you followed. So if you could talk more about the sort of shadowboxing fieldwork and why it was important to your research questions.
Thank you for the question. One thing that I learned immediately in embarking upon this project is that type 2 diabetes, particularly looking at it through the lens of the African diaspora or African descent community, required a multi-sided approach because type 2 diabetes is a complex illness. And due to social determinants of health varying according to demographics, according to geography, social economic status, and according to the ways in which knowledge, bioscientific knowledge about the illness is not only produced but circulated, required me to perform field work in different spaces. For example, one thing I found in diabetes education is that there tends to be a social economic hierarchy around who is able to attend diabetes education classes and where, the ways in which insurance companies are involved in diabetes education through various institutions. And I found that in some places that I went, the high-risk populations for type 2 diabetes, brown and Black populations, weren't present in these diabetes education classes. I found that through public health, the Alameda County Department of Public Health, for example, that those certified diabetes educators working through those offices performed diabetes education services in those areas and in those spaces where people who did not have the insurance, for example, to pay for diabetes education classes, which could sometimes run upwards of $800-900, found themselves situated despite the fact that they were living in negative resource areas, that they were dealing with food apartheid and other issues that can exacerbate stress and the experience of type 2 diabetes. The other end is that of the sites of knowledge production. And I found and was able to make contact with African descent researchers in Baltimore and Washington, D.C., who were doing work on type 2 diabetes, particularly in terms of genomics because while I was doing my research, and I talk about it in the book, the price of sequencing a genome dropped precipitously, and that totally changed the ballgame. And notions of risk went further back into ancestral time. And that began to elicit new conversations about race and risk that I thought were an important part of this conversation and warranted inclusion in my project. So I found myself not only attending type 2 diabetes research classes and that were geared toward the African descent community, but also diving deep into the archives at Johns Hopkins University in order to go through the Henrietta Lacks files from the HeLa cell that formed a really, really important part of the later chapters of the book. So as Lauren Nader urges to study up, that's what I try to do, and I hope that the book makes that clear. But studying up presents challenges for the researcher in ways in which studying horizontally, or perhaps even in community settings, does not present. And I found myself having to butt against various obstacles, which I was able to overcome through the networks that I had formed in the field, in terms of accessing people who are performing research in type 2 diabetes, in genomics, and the various agencies that and institutions that conduct these research projects. It's a Latourian sort of situation where matters of fact and matters of concern came head to head. And while there are people who simply wanted to focus on matters of fact, namely the science, the matters of concern that provide the context of understanding the science, to understanding, as mentioned earlier, these silences of refusal, the silences around the numbers of hidden diabetics and pre-diabetics in the population, made it incumbent upon me to try to present a more global and robust picture of the type 2 diabetes landscape. The initial project, the initial vision, arguably was a 20th century project. What happened with the sequencing of the, with the mapping of the human genome and the decreased costs of sequencing genomes brought it into the 21st century. And ethnography inevitably becomes historiography at some point. But at this particular moment, I found that this sequence of events, an important moment to document and to try to take an ethnographic snapshot of in providing a fuller picture of the type 2 diabetes landscape today.
Thank you for that methodological question. I will come at it from to kind of I don't know, somehow in thinking and reflecting about my work, which I find it so healthy. Thank you for this opportunity. Like returning back to praxis. Before the term shadowboxing kind of becomes a term that I hold on to, that I was able to connect my methodological experiences and paths to, which is, rooted in the radical feminist traditions, in a term that Georgine takes up in their work. I recognize that the ways in which, as a Black queer, lesbian woman myself in the field, that in navigating the terrain, right, of the research itself, in kind of figuring out ways of how to bridge and understand the two worlds of my participants as who they are in the world, and in those medical spaces, I was experiencing what it means to be a Black body, Black female body in a shadow box, right? That said, my training in seminary it was something that I always looked back on because, and I would always tell people, well, the seminary in New York City, among many things, one of the things that it trained me and shaped me to become was this like ethnographer, right? But in ways that womanists, African American, or rather Black religious studies scholars who identified as wominists through my religious studies training, and Black feminists. Before even starting doctoral work in the field, you know, I was already kind of oriented to doing ethnography and the Black feminist traditions of care, right? So of holding space, in ways that there's care, right? Like that we're promoting care, that we are celebrating and honoring emotional space, and you know, their corporal, like kind of like being in your body, spinning your body, and so forth. So I would say that there was a kind of a skill of discernment that I took with me into the field, that was both practical, both and even scholarly, right? Through kind of learning how womanists and Black feminists in religious studies did ethnographic work of Black women's lives and research. That said, you know, methodologically, I just, in terms of learning and figuring out what my methodological path is going to be, I did not, because I did not have many Black anthropologist mentors at the time, because I had transferred from religious studies to anthropology as a doctoral student. That said, it really, fieldwork for me was really make the ethnography what it needed to be. And so the word literally of what it means to navigate the field kind of translated into centering literally how my participants and the women and the Black lesbians I followed, how they navigated, right? So I would follow the paths of how women were navigating their lives, and that was my methodological path, right? So in that sense, it was clear to me that in respecting the privacy, right, of their gynecological visits, because I actually didn't have, although I kind of wanted to, and I do write in the book, actually, I have an interlude where I follow to a clinical visit, gynecological visit, one of my participants. But really, the kind of witnessing, right, that anthropology often seeks to in terms of field site and the institution being a field site, that was not my focus or even main interest. The focus was, how are these women or Black queer folks, how do we talk about, right, the shaping of their knowledge production about how they're interpreting the experiences within those spaces? And so that allowed me to make Salvador, Bahia, which is where my site is in Brazil, really a field site. The city, right, became my field site, primarily because, so prejudice, right, is a term that for them, right, for them came up a lot, right, during the research. Well, you know, the best ways in which we understand systemic power and how that's tracked into institutional spaces, and really institutionalized and structural violence, is to really study how that is happening in the world. And so family relationships, partners, family responsibilities, protests, and any which way that I could understand more, understanding Black queer subjectivity in Brazil, knowledge production to interpret the ways in which they interpret their experiences really was the methodological path for me. And in many ways, that is shadowboxing, right? Because of the erasures and invisibilities of struggles and of navigating life and making Black lives and staying alive and contesting death and all of these that it's that already the burdens, right, that are kind of superimposed by the traumas that occur in institutional spaces, is already, right, kind of occurring within the shadow box, within it, in the kind of shadow boxing, right, kind of experience, if you will. And as a open, again, Black, queer, woman with my interlocutors, I was able to really witness and feel, right, that sense of shadowboxing. So that's where I hinge on the term shadowboxing for me.
And if I could add, thank you, that was really rich. In terms of the field, in terms of shadowing in the field, one thing that I found in my work is that we have a professional set of actors known as certified diabetes educators who are charged with going out into the community, first of all, imagining the community in an Andersonian sense, and going out there and doing that particular type of work with a certain understanding about the community that they seek to engage, or the communities that they seek to engage. But what I found in my work was that the community health workers, the CHWs, understood the field, understood the communities, understood these demographic subsets of the population far better than the institutional actors did. And in that way, the institutional actors continue to imagine the African American community or the African descent community through the lens of the Black church. And I get into that in the book, particularly through Du Bois's arguments about the Black church as a center of imagined African American life. But certified health workers had a more holistic sense of the community, understanding that the community and the demographic category are dynamic and not static, and that they change over time. And as I show in the book about a particular community in upstate New York, this is a vibrant community that has attracted people from the West Indies, from Africa, from various parts of the Old South, and that in a moment in which 10% of the African descent community in this country is either first generation or second generation immigrant, a different sort of sociological imagination, if that's permitted, is necessary for understanding this community and reaching out to the community. So one thing I found with institutional actors is that their imagination of the community is quite bounded, rooted in historical stasis around what the community is, who the relevant actors are, and who and how they should be reached out to. And that was something that I think brought for me, and I hopefully for the certified health, for the community health workers involved, a greater illumination to the ways in which these workers, who are largely unpaid, have in terms of their ethnographic sense of communities and the ways in which they work and the dynamics of those communities, whereas the institutional actors are still dealing with or still working from older notions of culture, older notions of race, older notions of community, in ways in which they themselves, the institutional actors, are shadowboxing, right? To borrow my colleague's term here, for shadowboxing in ways in which they imagined that they were engaged in the righteous struggle or combat. So perhaps toward increasing and improving a community-wide understanding of type 2 diabetes, but missing the target quite often in the attempt. So the book, in a sense, charts this movement in my thinking and in the field from this biographical story of the family through my mother's prediabetes to the community itself, into the genome, and the ways in which kinship and risk through kinship gets redefined over time and across space.
Wow, thank you both. I wondered, because Nessette talked a little bit about the Black feminists that kind of influenced her approach. And I wondered if James, if you could talk a little bit about some of the Black feminists that helped you, yeah, kind of influenced your approach.
Well, through this interrogation of risk and its 21st century interpolation through genomics, my work took me to the story of Henrietta Lacks and the HeLa cell. And when the genome and epigenome of the HeLa cell were mapped in 2013, this opened a whole new area of claims making around metabolic risk, about metabolic adaptation to diverse environments, the ways in which humanity over time began to move out of Africa, if one is a monogenicist, and over time through transhumanism or human migration across the globe, began to adapt to metabolically to diverse environments, new diets, new climates, so on and so forth. So the HeLa cell and its mapping portended to create new stories, new claims makings around that risk. So inexorably, my work found itself moving toward Black feminist work, searching for lenses to try to better understand this nascent phenomenon. So I found myself delving into fiction. I found myself reading, once again, Toni Morrison's work. And this brought me also to Portia Spillers and Saidiya Hartman, trying to understand what mother loss and the decipherability of Black flesh means in this context. This was a completely unforeseen movement or foray into this area of scholarship, but I couldn't have effected the project successfully without it. So over time, I found myself bringing in other scholars such as Carla F.C. Holloway, Patricia Williams, Evelyn Hammonds, others who may or may not self-identify as Black feminist scholars, but nevertheless, their thinking proved interstitial to my work and to my analysis. And once again, I don't think that the work would have emerged in the way that it did without that interrogation, without that foray into that scholarship.
Yeah, and if I can just add, thank you, James, because I just want to make clear who the Black feminists in my camp have been. Just methodologically, right? I was just thinking about, who was I already before I kind of become a anthropology grad student in particular. Like I say, was initially a religious studies doctoral student at Rice, where Tracy West, right, who's a Black feminist, professor of ethics and theology at Drew, is one of those key influencers for me. But let's be also clear that, so I have a big jump, right, learning curve. 2010, I'm in anthropology. I go into the field, 2012, 2 years. So I had to quickly start, who everyone was in ABA, but I would meet Kia Codwell and Erica Williams at the National Women's Studies Association. And lucky for me, I even came across them in the field. And so they become the first Black feminists in anthropology who are starting, right, who are helping me kind of like shaping who I am. I'm doing field work and thinking theoretically. But Gloria Becker is the first person, right, who both field and theoretically is that Black feminist with me. And then there's a distinction, right, in who are the Black feminists shaping me in the field for field work and also in the writing. The writing is Audre Lorde, Zonia Hurston, her essays, really in particular, Cheryl Clark, Bell Hooks, Gloria Becker, Dana Ayn Davis, Leith Mullins, and then Christian Smith work along with other. So for me, that's the main calling that I would do.
Thank you to both of you. Really appreciate sharing sort of the journey that brought you to this work, and then also hearing a little bit about your influences. I want to focus a little bit on the writing process, and I think both of you don't hold back in featuring yourself in your writing. James, you give us an intimate glance into your specific family history as it relates to slavery, plantation, logics, and sugar. And so, and experiences of diabetes and the disease processes of type 2 diabetes. And in particular, using sugar as a symbolic and social artifact, and also the ways that sugar is sort of part of this of racial capitalism, and part of this process of both racial capitalism and also this ongoing sort of medical research or diabetes medical research industrial complex that you allude to. And then Nessette, you reveal the details of your own experiences with gynecological intervention as a patient and how this drew you closer to your participants. So I wanted to give you both an opportunity to talk about how you showed up in your own work in the writing process, and what was that for you? What was that like for you, both sort of academically and personally? And then specifically, Nessette, you speak about writing with fire, a reference to Jackie Alexander's work, and also ancestor work, which is in agreement with Savannah Shange's work. So I wanted to see if you could talk a little bit about that, and how you hope readers will engage with your writing.
Oh, thank you for that beautiful question. Yeah, writing with fire. I intentionally decided to kind of invoke Jackie Alexander in the book, just in that section that you're talking about. Having also experienced Fire and Ink, which was because it has now it just now ended. This conference doesn't happen anymore, but it was a Black queer studies, a Black queer writers conference that would happen every other year. And I was the second or third conference, which was my first, was actually in Austin. And I just remember driving to Austin from Houston. I couldn't wait to see all these Black queer artists and activists and writers at this conference. And I would say that transitioning as a writer from being a clinician, right, to now social sciences and humanities, which was really tough for me. I was born in that space as a writer, where I would meet Jafari Allen and many others, and it was really quite lovely. So the one word in terms of how I show up to my work now, which has been really a praxis, I would say, as recent, but over the last couple of years, and I hold firmly, is showing up as kindness, self-kindness, in entering my work, in entering writing and reading and note-taking. for me, unfortunately, as a result of some traumatic experiences that I've had with the review process, which many folks have had in the academy. But my first article was one of the reviewers was just extremely violent, while the other review was really very affirming and accepting. And it even onset for me a skin condition that's autoimmune called dermatographia. How traumatic that review was for me, it being my very first article. And really that was in 2018. And I think that as a result of really experiencing how we can be targeted, right? Particularly when we're writing at these intersections of race and sexuality and gender, so forth, in the academy, that the only way for me to live is to figure out how I'm going to be kinder to myself, right? And not among all the demands. But even so, in writing about my personal experiences having a hysterectomy, right, mid field work, not in Brazil, I had to come out of Brazil, but I read about that experiences, all of these kind of personal opportunities. Gloria Becker, is an anthropologist who really reminds us that, our subjectivities as Black, queer women, Black women, are really integral, right? We cannot deny that, right? Those experiences in the field, and we should not. And there really is a very Black feminist tradition to be, engaged in our own embodiments, when we're doing this work. And so for those reasons, the kind of careful line between, the power relation, even as researchers, with our work and in the writing, it should not be completely, should not be separated, right, from how we exist sitting in the chair when we're writing. And so, but I think we kind of all know that, right? Like we kind of know that, but what does that mean in praxis? And for me, showing up with kindness, and so not pushing through any hesitation of my hysterectomy produced a transnational knowledge production that's viable, right? How I identify as a Black queer writer, that is viable, right? But even still, right? So, and again, right, in the kind of self-legitimizing, if you will, that we constantly have to do, right? Because of everything that's coming at us, reviewing our work. For me, right, that is how I show up to my work. I can say more, but I like to hear what James has to say.
Thank you. In my case, the title of the book, Sweetness in the Blood, is a amalgamation of 3 works that have had an influence on me and my thinking around type 2 diabetes, around history, around the diaspora, around the relationship between the material and the subject and subsequent forms of affect. One is Sidney Mintz's Sweetness and Power, which had a tremendous effect on me in graduate school. Short, thin, a very thin tone, but extremely important to my thinking. I mean, it punches way above its weight. And the other book is Andrea Stewart's Sugar in the Blood, which is the story of a descendant from a plantation family, a person of color who descended from a plantation family in the West Indies, and the ways in which this interaction with history and the material and kinship and slavery and forms of inequality figured into not only her formation as an individual, but the formation of the society in which she grew up in. The third is Anthony Hatch's Blood Sugar, and the ways in which the notion of a racial metabolism is addressed in that book, and I argue against a racial metabolism in my book. I bring in James Neal, I bring in anthropological arguments arguing against the biologization of race. So I argue that there's no racial metabolism. Backing up, having come from a family that worked in the sugarcane fields on my mother's side in southwestern Louisiana, Mintz's work had a really powerful effect on me, because although Mintz addressed primarily the experience of the enslaved Africans in the Caribbean, I saw its ready translatability to the experience of my family and others who labored under similar circumstances in southern Louisiana. Paired together with the French Creole language, there are these connections to Haiti, not only linguistically, but also in terms of the economic botany of the forms of sugarcane that were developed in Haiti that were able to withstand the infrequent cold snaps that would descend periodically upon southwestern Louisiana. So for me and in my work, this became a situation where I had to argue against bounded notions of a certain African-American studies and embrace a diasporic understanding of what it means to be an African descendant in the Western Hemisphere. So Jacqueline Nassy Brown's work was extremely useful in deconstructing this notion of bounded nationalisms through which certain articulations of Blackness have been co-opted by the nation state, not only in the US, but also in the Caribbean as well. And I brought in James Clifford and Edward Glissant, who helped me to think more broadly about this history of interrelations between the societies, the formerly enslaved societies in the West, and Julian Scott's book, Common Wind, which I just read a few months ago, which came from his dissertation, really helped to cement this notion about those silences concerning the connections between African descent societies in the West that were heretofore pretty much thought to be non-existent. And this specter of Haiti, this specter of a particular type of resistance, and the ways in which that threat was periodically addressed and dealt with, not only in Louisiana, but along the Eastern Seaboard, for me, redounds to this conversation about how to deterritorialize notions of Black studies, of African-American studies. And through the genomics, through this notion of genomic kinship, the ways in which perhaps in the future, these notions of kinship will also break down the barriers of nation and state in the academy. Thank you, great question.
So I want to give some time to let people who are joining us ask a few questions, and a few questions have already come in. The first is from Daphne Scott Henderson, who writes, for Dr. Falu, as a Black lesbian who is a first-year PhD student and is very interested in examining intraracial health and healthcare disparities affecting lesbian identified African-American women, I'm curious about what made you focus on Brazilian Black lesbians versus Black lesbians in the US. Do you think their experiences are different or similar? And then I'm just gonna ask this second question because it's also for you, Dr. Falu. Then you can respond to them both. The question is, did you watch the documentary Chega de Fiu-Fiu, Enough with Catcalling, by filmmakers Amanda Kamenchek and Fernando Frazão? Do you see collective cultural changes happening in Brazilian society and culture now? And if so, how can you give, how can you give some examples?
Thank you so much. The second question, I didn't quite understand it. Could you repeat it?
Sure. The attendee writes, did you watch the documentary Chega de Fiu-Fiu? I'm probably not pronouncing that right. Enough with Catcalling. I guess that's the name of a documentary. by filmmakers Amanda Kamenchek and Fernanda Frazão.
Okay.
And then, do you see collective cultural changes happening in Brazilian society and culture now?
Okay. And I'm assuming culture changes around Black queer life, maybe just maybe more specific the question. Thank you so much for those two questions. Daphne, so your work is very, very fascinating. Would love to keep chatting with you, so please find me. Well, yeah, so 2011, I actually thought I could do at the time a comparative project between, or transnational project between Black lesbians in the US and Black lesbians in Brazil, Salvador in particular, with experiences on gynecology. And it was not just for me at the time, it was just, I couldn't really wrap my arms around it, though I did interview Black people in New York and in Houston. And to give the kind of attention, I've been traveling to Salvador since 2007. Pretty much very familiar with Black social movements, Black women's movements, Black feminists, theories and so forth, theorizations that, scholarly work and activists as well. But I knew very little about the healthcare other than being inside of some hospitals, visiting some people. And that said, so it just became, it was a choice that I had to make, one site over another, to just give it the attention that it needed. And for me, having practiced in New York, in the US, right, medicine, and know that I could come back and do another project in the US because, it wasn't really so much, an anthropologist needs to do a project in another country. Like, yeah, there was that, right? Like, you kind of heard those things, kind of noise in your ear. For me, I had an investment already in the lives of Brazilian Black women and Black lesbians in particular in Brazil, and so I wanted to do that work. And that's how I landed. That's how I landed. I will be continuing some Black queer reproduction work here in the US. So make sure that you find me. So we can continue the conversation. And to the second question, I have not seen the film. I would love to get the exact title from if you can maybe save the chat, Ugo and I did for me. It's kind of hard to talk about any culture shifts right now in Salvador from where I stand because of COVID, right? I visited COVID last year, was there for five weeks, and there are shifts, right? I think that COVID everywhere has made shifts, but particularly in Salvador, where culture and social life is such an outdoor thing, right? Outdoor music, outdoor performance. It's just so much. But that said, it's kind of hard for me to answer that question. Specifically, if we're talking about culture changes and the social life of Black queer women or Black lesbians or in Salvador and how they may be making those spaces. In my book, I talk about one of very few spaces where monthly gatherings of creative expression and those kind of spaces existed over the years there, far and few in between for Black queer women in terms of small social spaces to gather that are kind of like designated, this is where we're all going to gather. But it's kind of hard for me to respond to that question right now because COVID has brought many demands and changes and shifts to Salvador. And in particular, right, that's all I have.
Seems there's a question in the chat for Dr. Doucet-Battle. Drawing from your research on diabetes, I would like to hear your thoughts on the COVID pandemic in the US and whether you see similar or different dynamics.
Thank you. I was hoping someone would ask that question. Last year, the American Psychological Association published the findings of a report on COVID in the United States, particularly in relationship to stress and how it's changed the social landscape here in this country. And what they noticed is that there's been an inordinate amount of weight gain in the American population, present company not accepted. Every age group and demographic group up until the elderly 75 and above has gained weight by a factor of 2 to 1 pretty much among all age groups in this country since COVID hit. So lockdown, quarantine, shelter in place, Grubhub, Uber Eats, these things have changed the ways in which we live, the ways in which we eat, the ways in which we socialize around food. Part of my interest, particularly in terms of type 2 diabetes, and I talk about it somewhat in the book, is this, my biological anthropology background informs this, is this human history or this evolution over humanity's span on Earth, this link between sedentism and encephalization, and the ways in which over time we moved from being hunter-gatherers to sedentary populations who cultivated wild grasses, otherwise known as grains. And by and large, we began to sit down in one place, have more elaborate burials, and we began to encephalize through storytelling, through writing, and through various forms of a mental activity. And COVID created a situation where not only was sedentism increased and enforced by law and by statute, but also the ways in which our devices that we spend an inordinate amount of time in front of have seductively created a situation where our processes of encephalization and the appetite for encephalizing has continued and improved and found new ways of changing the ways in which we live and metabolize. So part of my ongoing research is looking at the future of the metabolic future of life in this country in the face of COVID and the social changes that have been wrought by the ways in which we live, the ways in which we eat, the ways in which we move and don't move. The American Heart Association, the American Diabetes Association recommends 140 to 180 minutes of aerobic activity per week in order to maintain metabolic health. That does not include walking the dog. We're talking about aerobic activity, and a lot of us are falling short from that. While at the same time, the pharmaceutical and the food industrial complexes continue to offer new ways for us to treat our inactivity, to treat our under and over nutrition in ways that portend a different type of future than we even could have imagined 2.5, 3 years ago. Thank you for the question.
Thanks, James. I think about my own work as a family physician and in my conversations with colleagues, especially in the pediatric population. Not only has there been weight gain, but there's been increase in diagnosis of type 2 diabetes in the wake of COVID. And so those are really important insights. We have a question for you, James, from Stephen Small. He writes, "Thank you both and the moderators for this stimulating conversation and key insights. James, can you say a bit more about Nancy Brown and the issues of bounded identities and the state? I may not have fully understood what you said, but I assume on the issue you were not talking about race and health in Liverpool. Of it."
No, I wasn't. Thank you, Stephen.
You were. I don't remember Nancy Brown mentioning health issues in Liverpool.
So good to hear from you, Stephen. Thank you. No, I was bringing Jacqueline Nasty Brown into conversation with Glissant and James Clifford and Paul Gilroy around this notion of diaspora in the Black Atlantic, and Clifford's notion of roots and Glissant's notion of a particular type of diasporic identity, which is not readily reducible to the nation state. And Nasty Brown warning those of us who wish to conduct research into diaspora about being extremely careful in how we engage the topic, given the complexity of it and the populations involved. And in bringing in Gilroy, it's an argument that, once again, in debiologizing race, allows for an analysis that goes beyond phenotype toward practices. What I really wanted to emphasize in the book is that type 2 diabetes is an acquired illness which can largely be sourced to practices and not biology in the way in which, for example, perhaps type 1 diabetes could, which we know nowadays is a viral, is caused by a viral infection that attacks the pancreas. So Jacqueline Nasty Brown was important in just simply trying to interrogate the notion of diaspora within the context of bodies and phenotypes, notions of difference, and forms of praxis. Thank you, Stephen. I hope that answers your question.
I see a hand raised. I don't know if that can happen. But so a question from Dr. Charles Briggs is, what are the audiences you want to reach with your books, and what do you want them to do differently?
And I'm just going to add on specifically for you, James, what I found so in my other role as a physician, what I found so thrilling about your book was a succinct challenge to race-based medicine. So I think we would be remiss to not hear a little bit about that in your response today too.
Oh, I can go first so that you can, yeah, elaborate on the second part. It's funny, I was once asked, I had a book conference for this manuscript before I submitted the first manuscript for review to the press, and I was asked by the fabulous people that were at this book conference that who would be my audience, and I asked them, can I be honest? And they was like, of course, absolutely. And for me, it was Black lesbians. And we know that we have to, for tenure and the whole performance of it, kind of write this first write this way the book in ways that that it's not made for the public. But that said, I knew that stylistically, how I would be writing would be kinder, right, in many ways. To the storytelling, right, and the kind of thinking, and in really truly centering the knowledge production of my participants in that way, where I can envision this is a book that, yes, I'm writing for the academy in many ways, but it really is for them, right? Because yes, it's about them, but it really is for them. And so, but in that sense, also as an audience, they, but otherwise, I mean, the book is, I would say, the medical community, right, of public health, that should also read narratives, right? In the same ways that, they create narratives and medical narratives, right, and the social within the medical world, constantly making the social, that in that sense, that's the other audience, and Black feminists, I would say, right, for me, that would be.
Thanks.
Thank you for the question, Charles. I wrote this book for several audiences. One, anthropology. That is where I first developed my ideas for the book and conducted the research. And I wanted to pay obeisance not only to the discipline that nurtured my thinking, I also wanted to engage Mints and bring Mints into the 21st century. I wanted to also engage science and technology studies because when I was in graduate school, I finished in 2012, the notion of an African descent or an African diasporic science and technology studies didn't really quite exist. Now we're sort of forming a nexus. And those of you who are interviewing me as well, I mean, us as well, Ugo and Adeola and others, Victoria Massey, we're on the ground floor of building something in STS that is actually reflective of research among African diasporic populations. I also wrote the book for those in public health and in biomedicine, those who are working in the area of clinical research and recruitment of African diasporic populations. And most of all, I wrote the book for the community itself, for the African American community that I worked with in upstate New York. I did some work here in the Bay Area, but I found that all of the churches in Oakland, at least most of the large churches, had already been colonized by other universities who wanted to know how congregations were thinking about Henrietta Lacks and whether or not they would be willing to donate biosamples to X institution. So in terms of the racialization of medicine or working against that or refusing it, this notion of type 2 diabetes, and I talk about it in the introduction in chapter 1 of the book, is that in the African descent community, type 2 diabetes is seen as something that one just acquires along the course of life. There's a fatalistic attitude quite often around type 2 diabetes and acquiring it. And I wanted to convey to the community that it's not biologically determined necessarily in terms of the numbers that we see of people who are diagnosed with type 2 diabetes, that this is something that is in many respects socially constructed through social determinants of health and illness, that it can be redressed quite often, at least 80% of the time, through diet and exercise modifications. And there have been events in which the book has been offered. Diabetes Month in November in upstate New York. The book was presented to the community there. It sold out in a matter of minutes. I was concerned that perhaps the book had a little too much jargon in it, a little too much Kroger Hall, but no, it didn't. It went down really well. People are awaiting my return to the area to autograph the books, and it was just really a heartfelt way of confirming and validating the work that I did in the community and the message that people really, really want and need to hear. Thank you.
Thank you.
So there are a couple more questions in the chat, but I did want to give an opportunity for both Nessette and James to engage yourselves if you had any questions for each other, or if anything emerged from either of the responses, or your responses that you wanted to push a bit more.
Yeah, no, I'm happy to take another question. I mean, if there's a question that the audience, unless James, you wanted to.
Well, having read some of Nessette's provocative and generative manuscript, I am really curious to know what sort of second project might you have in the works or in mind to pursue?
Yes, low battery. Yes, thank you, Jean. So I have the same question for you too, actually. And I was also interested in like how we might maybe also reflect on the share of worth, right, and value. Yeah, right, and I thought that was really. Well, this very immediate second project that I'm doing before I loop back to ethnography in that sense, which would be I'll be returning eventually to Brazilian Black lesbians' experiences with reproductive cancer in Brazil. I'm really committed to that based on some experiences that I had in Brazil. The very next immediate project is taking a slightly different turn. It's a study of sexual violence in medicine, not literally in the history and by physicians, and not just like in sport medicine physicians, but literally a whole long history of sexual violence by physicians through a Black feminist lens. And that's going to kind of really one of the goals is to kind of figure out a way to expose the racial dynamics of this, but how these predatory logics, sexual predatory logics, are really really tied to the sexual violence socio-historically of Black bodies in the U.S. That so much kind of has structured the system of medicine. In this kind of institutional way. The very easy practices of concealing and hiding and covering up and reporting and so forth and so on. So that's my very next meeting. That's the book that I'm already collecting data on and that I should be ready to take on pretty soon. What's next?
What am I working on next? I'm working on a project entitled Laboratory Life and Social Death, the problem of diversity in science and society. And I'm looking at the demand for sub-Saharan African DNA among researchers who are seeking to build genomic reference libraries to offset the predominance of mostly Euro-American samples in biobanks. And I'm looking at how the scientific demand for sub-Saharan African diversity is running counter to ethno-nationalist refusals to diversity within nation states in the global north. So I want to try to take a look at how researchers in sub-Saharan Africa who have taken up this charge of collecting sub-Saharan African DNA run into larger structural issues of scientific and citational racism, the refusal or the rejection of their papers by journals who claim that they don't have sufficient population sizes or sample sizes in order to make their research viable, and how this also, in a sense, feeds into this question of scientific knowledge production in the global south vis-a-vis the global north, and to counter that with the ways in which ethno-nationalist impulses against that very diversity exist in the global north. We'll see how that pans out on Sunday when the second round of French elections are conducted. But I really am interested in how this dual dynamic is operating in the present time. The premise of the work is to take Du Bois into the 21st century and to argue that the color line is not the problem of the 20th century, but that diversity is the problem of the 21st century. And I want to try to make sense of how that's working out in the lab and in society.
Thank you so much. I think we're running close to time. So I just wanted to see if Nessette and James had any last thoughts for us. And then I think we'll have to close after that.
Well, I'd like to thank all the relevant parties and sponsors for inviting us to think together today. I can be reached. I'm more than welcome to continue this conversation via email or even Zoom if some of you would like to meet. jbattle@ucsc.edu. And I look forward to hopefully continuing this conversation as well. Thank you.
Yes, and thank you so much. Just practice mindfulness. It's the work that has to be done, but to make sure that it's not at the sacrificial expense of your life.
Again, just want to thank everyone, thank the audience, thank again Professors Falu and Doucet-Battle for a wonderful, wonderful discussion. Please follow us, well, if you want to, follow us on social media at BFHSS Collab to stay updated on the next lecture in this series, which will take place at UCLA in the fall.
Once again, thank you to everyone. We understand that the situation is tense on campus, and so we thank you for joining us and hope that everyone is safe, and we hope to continue these conversations. Apologies to the people who asked a couple questions that we couldn't get to, but we have immense gratitude for Dr. Falu and Dr. Doucet-Battle. Thank you.